Hello everyone, myself Trupti Dilip Jadhav from Shivajirao Jondhale College of Pharmacy, studying in second year of B Pharmacy. Today I am going to explain drug interaction under the guidance by Dr. Nitin Moire sir as a principal and professor of our college. Now, what is a drug interaction? Drug interaction is defined as the pharmaceutical activities of one drug is altered by the use of another drug or by the presence of some other substances. Some are helpful but often produce adverse effect. Now, what is a common drug interaction? Additive effect take place when two drugs are given together and double the effect is produced. Alcohol plus aspirin gives pain relief. Antagonist, a chemical blocks another chemical from getting to a receptors. Antagonistic effect take place when the one drug interferes with the actions of another drug. For example, protamine sulfate to counteract hairpin toxicity. Factors contributing to a drug interactions are multiple drugs therapy, multiple prescribers, multiple pharmacological effect of drugs, multiple disease illness, poor patient compliance, advancing age of the patients, and drug related factors. Now, mechanism of a drug interaction. The two mechanisms by which the interaction can develop are pharmacokinetics interaction and pharmacodynamics interaction. Pharmacokinetics interactions are those interactions in which ADME properties of the object drug is altered by the precipitant, and hence such interactions are also called as ADME interactions. The resultant effect is altered plasma concentration of the object drugs. These are classified as absorption interaction, distribution interaction, metabolism interaction, and excretion interactions. Now, absorption interactions are those where the absorption of the object drug is altered. The net effect of such interaction is faster or a slower drug interaction, more or a less complete drug interaction. Major mechanism of absorption interactions are complexation and adsorption, alteration in GI pH, alteration in gut motility, inhibition of GI enzymes, alteration of GI microflora, and malabsorption syndromes. Now, distribution interactions are those where the distribution patterns of the object drug is altered. The major mechanism of distribution interaction is alteration in protein drug binding. Metabolism interaction are those interactions where the metabolism of the object drug is altered, and mechanism of metabolism interaction include enzymes inductions, increase rate of metabolism, enzymes inhibition, decrease rate of metabolism. It is the most significant interactions in comparison to other interactions and can be fatal. Excretion interactions are those interactions in which where the excretion patterns of the object drug is altered, and major mechanism of excretion interactions are alteration in renal blood flow, alteration of urine pH, competition for active secretion, and forced diuresis. Now, what is a pharmacodynamics interaction? Pharmacodynamics interaction are those in which the activities of the opposite drugs at each site of action is altered by the precipitant. Such interaction may be direct or indirect. These are also two types, that is direct pharmacodynamics interactions and indirect pharmacodynamics interactions. Direct pharmacodynamics interaction in which drugs having similar or opposing pharmacological effect are used concurrently. The three consequences of a direct interaction are antagonism, addition or summations, or synergism. Now, what is antagonism? The interacting drugs have opposing action. Example, acetylcholine. Addition or summation, the interacting drugs have a similar actions and resultant effect as the sum of individual drug responses. For example, CNS is present like a sedative and hypotonics. Synergism, it is an enhancement of the actions of one drugs by the another. For example, alcohol. Indirect pharmacodynamics interaction in which both the object and the precipitant drugs have unrelated effect, but the latter in some way alert the effect of former. Example, cyclate decreases the ability of the platelet to aggregate, thus impairing the homeostasis. If warfarin induced bleeding occurs. For more information, we can also refer these two slides. We are thankful to our President Honorable Dr. Shivajirao Jondhale sir, Secretary Honorable Dr. Geeta Khare ma'am, and the Principal Dr. Nitin Moire sir for encourage and guidance for the efficient use of social media to spread knowledge through making informative videos. Please like and subscribe our channel for such informative videos. Thank you.